Good evening, and welcome to another exciting evening of the Antioch Summer Health Series. We pray that you have enjoyed all that you have seen so far, and hopefully you've been able to share it with neighbors and friends, some of the information that has been shared thus far. For those who have been with us since the beginning, we started this in the first Wednesday of June, and we've been dealing with issues with the physical body and physical health. And then on last week, we kind of took a turn and start talking about mental health and some of the issues surrounding that. And as we know, particularly coming out of a pandemic, there has been a lot of fallout in particular into mental health. And so we've been able to bring some of the top specialists from the field of mental health to come and just share with us. On last week, we had Dr. Jonathan Shepard, who from Baltimore, Maryland, who is a clinical psychiatrist there, speak about grief and the different phases. And on tonight, we're going to delve a little bit more into mental health. So hopefully after these next couple of nights, you will be well versed in mental health. So I had asked a question on the first night, and I'm going to pose it again. I actually posed it to one of my patients today who is dealing with some mental health issues, and she was describing how the process is slow, and she was a believer, so we could speak from a spiritual standpoint. But again, I asked her, do you want to be made whole? And that's a question that each of us have to ask ourselves. Are you willing to pay the price, the cost to be made whole? Because it's not something that's just going to come through osmosis. This is something that you have to work on. And so hopefully we are giving you tools and resources that you can work that more better on the mental health. So that being said, I'm going to ask for us to bow our heads so we can have a word of prayer. Then I will step aside and give you into the capable hands of Dr. Angela Allen, who will be moderating tonight's discussion. She will also introduce our special guests on tonight. So that being said, please bow your heads. God, we just thank you for this day. God, we thank you for your grace. We thank you for your mercy. We thank you for your love. God, your love that you would allow us, God, to be exposed, God, to a ministry that's holistic and that would be able to speak to all the components of ourselves, our spiritual body, our physical and mental sides, God, and emotional sides, God. God, we just ask, God, that you would come in even on tonight, God, and that you would get into our speaker, God, and be able to share words, God, and nuggets, God, that will be able to help us to get through this life, God. We thank you for the leader, God, even of this ministry, Dr. Logan, and his wife, Sister Missionary Christine Logan, God. We thank you for their leadership, God. We thank you for them stepping aside, God, to give us the opportunity, God, to speak to your people as it relates to the physical and the mental components of our temple. We just be careful to give you the glory, the honor, and the praise. In Jesus' name we pray. Amen. So with that being said, I'm going to step aside and I will give you into the hands of Dr. Angela Allen.
moving ourselves from our home, making ourselves accessible for the community as opposed to always being in the home. So then we gained isolation. Could you tell us a little bit about mental health, the mental health concerns, the mental health background, and particularly the number one concern as it relates to mental health is mental health and depression?
Yes, and thank you for the introduction. And thank you all for having me here tonight. I wanted to expound on that because not only did COVID bring out the instability of all kind of life foundations and what we call the hierarchy of needs for a stable mindset period, it also brought us to vulnerability that we were not, you know, who knew on January 2020 that our lives would drastically change to where we would be brought to a standstill. So knowing that, that not only impacted depression, and depression, a lot of people may think that it's the sadness, blues, but when we get to the part where we start being concerned is when we call it clinical depression. That means when it starts impacting your life, such as your job, your relationships, not able to keep your mental stability of getting, you know, some people think, oh, I'm depressed if I'm sitting down, balled up, crying all day, but that may not be it. It may be just irritability, snapping, more edginess, unable to sleep, or sleeping too much, or unable to deal with regular lifestyle changes, just feeling overwhelmed and under the, under siege, if I would say that, to be dramatic. But the thing is, it's not just the, like, okay, my house burnt down and you're sad about that. That's not what we call really depression. Depression is something that lasts 2 weeks or longer. It's almost every day, but it's encroaching on your lifestyle. When we talk about depression versus just regular depression and clinical depression. And COVID did notch those up for us. So we want everyone to be on the lookout, not to just so we can diagnose you with something, but so that we can make sure that you are transitioning into this post-COVID healthy and whole. And just that would be my biggest take on tonight, is to make sure that we're not just trying to put another label on someone, but we want to make sure that you're living the best life you can and that these things are not stealing your joy.
Dr. Norris, you said something, and I don't know if many of our listeners and our viewers were hearing something that was shared last week. Someone had asked the question, I think Dr. Pullins had read the question. It was, what is the difference between just depression and clinical depression? And so what I'm hearing you share is that there is a difference of acute depression, where unfortunate situations may have occurred, and that person may be sad for a short period of time, such as a loss of job, which is income, or perhaps something that may have happened just at that point and the person is just depressed, they're sleeping a lot, but then all of a sudden they get out of it. And then there's that chronic depression, or I'm assuming you're talking about that clinical depression, where the person has had a long stance, and you've actually talked about the number of weeks that that individual will go through that down period, and then all of a sudden they may be up for a minute, but yet and still they're still having some periods of depression. Could you elaborate on that? Because I'm hearing people say, I'm depressed, and then all of a sudden, afterwards, they're no longer depressed. And there are others who say, I'm depressed, and then they go through those bouts of depression, may be okay for a certain period of time, and they go right into those depression. Share more information about that.
That is a good segue, because we do use that term loosely. Depression, to me, when I hear it, when someone's presenting to my office, I'm looking for a clinical reason, something that is out of place. Perhaps it's depression, which is, like I said, 2 weeks or longer. So you may go through a job where you are depressed, you're sad, you don't know what's going to happen to you, you're worried about your income, you're worried about housing. And with the housing market the way it is now, if you lose a certain place that you've lived for a long time, the aspects of getting that same place or something similar at that price is kind of out of touch. So that there rushes in the anxiety. So when the depression is when it's messing with you being able to get up and get moving, or changing your personality, or having an impact on you where you feel heavy. And if that heaviness is lasting more than 2 weeks, I implore everyone just to talk to someone. It doesn't necessarily mean that we're gonna just institutionalize you or throw you on medication, but it's good to get that out. It's good to so it doesn't go into clinical depression, so it doesn't go into chronic depression, which chronic depression is something that people deal with for years, and they can, like cyclical, kind of what you're talking about, in and out, but that may just be that they need to get coping skills. So depression, when it becomes a medical disorder, such as the illness is when you are unable to keep up your, or you're keeping up, but you're keeping up at a pace that, where you know that you're impeded. You are, either crying yourself to sleep or not sleeping or not eating, losing weight or gaining weight at a ridiculous rate. When it's actually impacted your life is what we're looking for. And then we don't want it to get that bad. So we want people to kind of get away from the way Hollywood has demonized people with having those challenges. We want to make it normal to be able to reach out and talk to someone. Most of the accessibility things are, if you do still have your job, they have, different things available to you. And then also, your church home, going to and consoling and using prayer with others to get through that. But I don't want it to be like someone waits to that point to where they're losing everything. Kind of recognize the symptoms. You're doing this for 2 weeks or more, talk to someone before it goes over the, over the ledge. Don't wait till it's major depression. That's how we kind of classify it.
And the word "we," you said that, and I want to elaborate on that a little bit. I know we're stuck on depression because that's huge, especially as it relates to mental health. When I think of "we," I think of African Americans.
Yes.
I mean, we can look at all ethnic groups, we can look at all age groups, but in particularly African Americans, particularly those who are middle aged, because they are the ones that actually are holding the fort, if you will. When we look at depression and we look at the word, we hear the word "we," and we think of African Americans, there's that stigma. The stigma that identifies that it isn't okay to have some type of mental illness such as depression. But what you're saying, it is okay. It's considered healthy. The concern is not the diagnosis. The concern is not getting help for the diagnosis.
That's correct.
And that help, you've pointed out, spiritual help, talking to your pastor, talking to a spiritual partner, talking to your loved one, talking to maybe even taking those steps before getting to you as a clinician, and then saying, yeah, there is a problem, and maybe having that support system. When an individual goes to you and they're asking you those questions, and you talked about clinical depression, that chronic, what type of instrument, tool, what do? Do you just ask them questions and you determine it? Or do you actually have an instrument that will determine whether they are in depressed mode?
There are, the great question and great segue. And then when I am saying "we," I do want to emphasize on our community, the Black and brown community, because too long we have been told that we're superhuman or subhuman, whichever pocket you want to land in, but we're human, and it is a human emotion that stress does hurt. And if stress is not managed in a correct way, just like you said, I always think of one big thing I say: secrets keep us sick. So, and even biblically it tells us to go seek out the elders of the church and have them and talk with them. So when we think of mental health, if we liken it to diabetes, high blood pressure, people will be readily coming in and not questioning you. No one tells you, think your blood sugar down, you're gonna be okay. Or, so I think we need to normalize it between us. And even when we go to our providers, sometimes providers are even uncomfortable if you bring up depression, but depression screening, as that tool that you mentioned, is a PHQ. Usually it's a PHQ-2, and then if you trigger, answer yes to one of the questions, you go into PHQ-9, where we ask you, how many days a week are you feeling like this? How many times are you feeling down? How many times are you crying? Did your appetite change? Are you not feeling pleasure from doing things that normally? So if you were a painter and now you pick up the brush and you just don't feel it, those are all telltale signs that something's wrong. You watch your regular TV show and you can't get the laugh out, or you can't be with your spouse and feel that same happiness and joy. You feel like the joy has been stolen. Those things need to be brought out. And our community should be able to usher in our own health and take care of ourselves. Because as we've seen with COVID, that we were, you know, our numbers were statistically higher than any other group. So with our numbers being that high, we need to look at it. And to me, living in America, we already have this insurmountable stress that's on the weight of our shoulders, with the microaggressions that some of us may get at work, that we're already, you know, so if our body is already constantly under stress, and then we add a pandemic, and we add all this loss and all this death and destruction around us as far as jobs and different things, I think we just need to take the lid off and open up and talk about these things. So so it doesn't have to be every day, but nearly every day. And it's a personal thing. You know when something's hurting you and bothering you. So my thing is to get it out, and to, even if you come to a person like me, I'm going to look for, is it impacting your work, home, different, what stage are we at? If we're at a critical stage, maybe we need to bring other tools in. But usually a PHQ-9, if a person is really feels comfortable answering the questions and telling someone how bad it is, usually those tools are very good. I typically, personally, don't rely on them wholeheartedly, because it's all on our relationship, how much you're going to tell me and how much. So I just simply allow that time when I'm talking with someone to let them talk and tell me how things are going, to explain a certain situation to me. And I look and listen for key words that let me know how this person is coping. Is this different from what you used to do? Are you happy with your outcome? Are you happy the way you're presenting yourself? So I mostly rely on the history and the talk.
And the relationship that you have with your patient.
Yeah, and to develop in that, you have to develop a therapeutic relationship. So I think you can do the tools, and some people are dead on the tools, and we know, oh, you're in trouble, you know. And then some people, I come and they filled out all the tools, and then they said nothing was wrong on the paper. And then when I'm with them an hour and a half later, I'm like,
yeah,
we got to get some help.
I can see it. Speaking of I can see it, what about, we talked a lot about depression, but there's the number 2 concern when it comes to mental health, and anxiety. I mean, I could tell you depression was that down period for some people, but anxiety is that unexpected expectation of what may happen due to COVID with my family, with my friends. And I'm talking about health, not even just economically, not just losing your home, but just the fact, oh my God, I've touched something, I've done something. And then the fact that just having a history of anxiety. Tell us a little bit about anxiety disorders.
Well, anxiety is really expected part of life. We have anxiety about, you know, I had anxiety tonight. Am I going to present well? Am I going to do okay? So that's just, it's something that naturally occurs.
Right.
When we get into trouble is when it's debilitating, meaning it's impeding, again, that whole word, impeding our life, where we, you know, Sunday night, you can't sleep all night because you're thinking about going to work tomorrow, and you can't function, and you're up, and then next thing you know, you have a bad day at work because you stayed up all night. Or anxiety is just when what we call ruminating, the thoughts over and over again about whatever is making you feel uncomfortable.
Right.
Those kind of things with anxiety that we look at. And even anxiety has so many layers. There's 7 different types of anxiety, but the one tonight we're talking about is generalized anxiety, where you get locked in on certain situations or situation, and not a phobia, not like spiders or anything like that, but and what I mean by phobia means that you're scared of a certain thing, but you're anxious about it. You know, like this, you get anxious before you take a test. You get anxious when you're going on a job interview. But the person with an anxiety disorder, they can't get over it. It's bothering them over and over again. It may cause palpitations of the heart. It may cause them to have sweaty hands, or it may cause them just not to go and do something because they just feel overly worried and overly nervous about something.
So you talked about anxiety as a whole, and then you said something about generalized anxiety. Is that a difference, or is that a different diagnosis?
It is. Generalized kind of is our salad, if you will. where we put everything goes into generalized anxiety. So people with these it can be a myriad of things where you're worried, like you said, about health. That generalized anxiety came out a lot with COVID because we kept getting conflicting information. Mask, no mask, mask, no mask.
Right.
Go out, don't go out, go out, go out, open, close, you know, so all those things, you're like, oh my goodness, what's happening? So in all these things, when it became, you know, we had people that had to bear down, that wouldn't even, you know, go outside and you know, end up or not even return to work because they were like, their fear had overwhelmed them because of, you know, the different circumstances. So generalized, meaning that it's a myriad of things. It's not focused on one thing. It's you know, like I was saying in the slide, it could be health, it could be work, it could be any day actions like, oh, I'm worried about this or I'm worried about that. But generalized, it's not, you don't let it go, you know, kind of, if that makes a little bit more sense.
Maybe if you elaborate a little bit on the symptoms. What about some of the symptoms of generalized anxiety?
Definitely the symptoms would be kind of like easily, it almost mimics depression, if you will. It's kind of hard to look at, to pierce out depression and anxiety all at the same time. But you definitely you're restless, you're feeling really tired because you've worked yourself up in your own mind. And then having difficulty focusing, concentrating, and again, irritability, muscle tensions. You actually start having what we call somatic complaints, meaning something hurts on you, and it's maybe muscle fatigue because you're tensing up, you're doing different things like that. And then having out of control where you can't control the worrying, where it's actually overcoming you to where, you know, you're crying or having outbursts or something, or you're like just avoiding different things to stay away from certain situations or different events. And it's kind of very hard with COVID because we needed to stay away from events.
Yeah. You know, the word had was shared in your statement. You said we had anxiety. Well, let me just share this with you. I want to pause a little bit before we go into stats because I know we're going to do that. I love stats. I love what's going on now. The word had is probably something we may need to remove today because people are still having bouts of anxiety and even depression because of COVID, because they don't know what to expect. Even healthcare professionals. Absolutely. And I wanted to kind of talk a little bit about that. When we talk about anxiety and depression, particularly anxiety, we talk about you don't know what to expect. So what happens is, because your mind is not tuning into what to expect, stay inside, go outside, wear a mask, not wear a mask. I mean, we're running into that in our church, you know. You know, let's be cautious. Our pastor has been very cautious throughout these times, has been very receptive to what has been provided to him and our congregation to make sure that we remain safe, to be safe. Could you talk a little bit about where people are now as it relates to returning to church, returning to work, that anxiety? Because I'm hearing people share, and this is not a joke, this is for real. I am too scared to go back into the house of worship. I am too afraid to go to work.
Absolutely.
But I can see them out and about in other environmental areas. Is that an anxiety, or is that a concern because they're just not there yet and they just don't want to make that transition?
It may be, that may be, we're going off into kind of personality, where if your actions are not matching up with your words. Because if you're having true anxiety about being scared of COVID, then you're scared of COVID out and about, you're scared at work, and you're scared at church. So that is kind of that right there is a different kind of thing.
It's more individualized.
Yeah, that's more individualized.
Because I've heard the word anxiety. I'm too anxious to go into the environment, but I think they're utilizing, I guess where I'm going with this, the word is being utilized too loosely.
Correct.
I think you have defined it.
Yeah,
you've talked about it, both depression and anxiety, affecting the activities of daily living.
Correct.
If I cannot function the same way I have functioned prior to having this diagnosis, whether it's I'm diagnosing myself or someone, or, you know, if you are diagnosing me, then therefore it is obviously that issue. But if it is not impacting my daily living and it's my choice, it's my individualized personality, then there goes the fact that it is not anxiety nor may not be depression.
Well, yeah, and I would like anxiety is used loosely. When we try to use it in the clinical sense, then we get into the generalized disorder.
Okay.
That's when we add that disorder to the end of that. And I'll go back to you with that when you brought up the word had, and I like that. I'm glad you brought that up, because there are still, I'll give a personal story for myself.
Sure.
So when COVID first started out to really know something was wrong, kind of like in April, May-ish of last year, I noticed that I'm a big news buff, which I had to stop because that can lead you into strange places. So I would watch news that was overseas. So when I saw, we're both healthcare professionals, so when I saw overseas, I saw them in PAPR suits, hazmat suits.
Yes.
But here in America, when I went, I had an unfortunate cousin that went to the hospital, and everybody's walking around, no mask or mask, but had just a little breathable mask that goes, that's a surgical mask, if you will. But that doesn't really keep out particles the way it should if we are having a disease process or a virus that's being transmitted through the air. So I thought to myself, when I seen the PAPR suits, which means that it's airborne, and that means that you're protecting yourself from airborne things, but we had our CDC and our health officials said, no, not at all. You don't even need that. Just save all the masks for the healthcare workers and different things. I was in a panic because I have my family members to worry about.
Yes.
And all of us in Michigan was hit pretty hard. I'm originally from Michigan, so I'm stressing to them, sending them information that I'm getting from other sources and saying, please wear your mask, please do this. So that caused a big moral rift for me, being a healthcare person. So when I knew, I was anxious and I had anxiety and I was really getting depressed at the numbers, because when I'm not equating the number ticking up, I'm looking at the souls that we are, and my different colleagues that are dealing with this, and seeing the trucks pull up. So it was a difficult time. So you're right. I shouldn't use the word had, because those stressors are really amongst us. So that was kind of the segue to making sure that we use that, but also not to use these terms loosely. But I'm kind of biased on that. I like the loosely because I want us to get used to saying it. Because
I agree.
Because before COVID, you could never say, oh, I'm depressed or I'm anxious. People look at you, real. But now they be like, do you need, we sit up and we kind of take heed to it. Like, wait a minute,
there's something going on.
And to tell the truth, our numbers for suicide in the Black and brown communities were really high amongst our adolescents and young adults before COVID. So me hearing people say anxious, oh, it's time for me to talk, it's time for me to say something. But like I said, it's predominantly going, and it should show through your actions wherever you are, if that anxious and anxiety exists. You can have specific anxieties, not to say that doesn't exist.
Right.
But going back to your sentence, it should match up.
Okay. So let's talk about numbers, speaking of that, because I think you pointed that out earlier. I talked to you earlier and I said that before pandemic, and you said it as well, that we had Black and brown people, and all people of course, had issues in relationship to anxiety and depression. Have we seen an increase? I could see on the slide, many of our viewers are seeing there has been an increase. Could you talk a little bit about the increase and why?
Well, all the big official numbers are not out, but preliminary numbers are showing us that right now, people coming to their healthcare providers, because this study was done by the Kaiser Family Foundation, and they had shown where before pre-COVID, it was 1 to 10 people reporting depressive anxiety symptoms. Now you see it's 4 out of 10. So the uptick is there. And I've also noticed in the clinical setting, our calendars fill up a lot faster now.
Wow.
Post-COVID, it's more, people are, because of we were impacted as a society, it's way more prevalent, and it's out of the closets, so to speak. And right now, they said the study has found that young adults are really suffering with that. They said the symptoms are reported 56% of the adults, as well as adults, that lost their households and stuff, the children are feeling it. And especially because they were not in school and they were not able to be with their peers. They missed that socialization. Some people, missed graduations, birthday parties. It was like we lost a year. So I assume that these numbers will go up as we move further out and we start doing more studies, because I know I work for a major medical corporation myself, and our numbers are not all there yet because people are still scared to go and venture out. They still haven't did their annual exams. They still haven't, so we haven't got all those questionnaires and those ticklers to see just how much COVID has impacted people with their mental health.
And I think when you talk about studies, you talk about longitudinal studies.
Correct.
COVID has not been in effect long enough for us to actually collect the data at a long-term stance to determine the outcomes of whether an individual is depressed or actually having some anxiety. In addition to that, we also haven't been hit hard enough financially and in other areas, particularly in areas, and when I say hit financially, because we have stimulus checks still coming. We have other type of finances that are still out there that are allowing us meaning people of color, black and brown, and then people period, to still hold our heads up so that we can live sufficiently in this country and in any country. So I think we have not been hit hard enough for us to even get to that low level or high number, if you will, when it comes to obviously the anxiety and depression. But I know that we do have studies out there, and unfortunately we are going to get data that we're going to be very surprised of, and as well as not only surprised of, but we're also going to get qualitative data because people are going to start sharing their stories, and that's what we're hearing more of.
Correct.
What about a different type of post-pandemic mental health stressor, domestic abuse? I heard that has gone up tremendously.
It did, unfortunately. That was one of the first things that we've seen last year was the uptick in domestic violence, particularly because we were housebound and the loss of income, the loss of jobs. So if you were in a stressful cohabitating thing and now you can't leave. And I think those numbers are still going to rise and still going to be very much impacted, especially in our community here in the Phoenix metropolitan area, because of the lack of affordable housing, where people are not able to move and shift as they would like to. And also the stressors of having, we hear a lot of having the children home, and then the children also having a difficult time. So the household is very much disrupted. So therefore, these domestic violent things, unfortunately, had a great uptick. And I think, unfortunately, I think this is a call to action for us to make sure that we, kind of look at mental health seriously and really try to make sure that we're trying to be there for our brothers and sisters and really listen to them. And that brings me to the segue of, not minimalizing when people come to talk to you. Sometimes, people are uncomfortable. And if you're uncomfortable, that's okay. But always try to offer, do you need me to help you find someone to help you with this? I may not be the best person, so definitely we saw that being isolated, being unable to move freely has been unfortunate uptick in domestic violence.
Another abuse that I know has been, as you call it, an uptick, an increased number, is alcohol abuse.
Yes.
Even just substance, alcohol, marijuana, and any other type of drug abuse. Could you share a little bit about that?
Yes. At the clinic, I specialize in substance abuse and alcohol use disorder. So, so what I've seen is, if people don't have coping skills, they're turning to things that may not be healthy for them. What you brought up earlier, we were isolated, from our church gatherings, and everyone didn't have access for internet or didn't have stable internet, or internet wasn't affordable to them.
I was going to
say. This unfortunately led to people trying to dull their senses. And what dulls your senses? Substances such as alcohol or drugs. We already had a drug problem before the pandemic. So now with, unfortunately, I know this is kind of controversial, but what I've seen is even with the unemployment money and the stimulus money, those were used, unfortunately, by some to delve into that world, because the reality was kind of bleak and it was very ugly for us a while. You mean, if you looked at the news, like I alluded to earlier, all you saw was death and destruction 24/7 on a cycle. I had people, what I had to make contracts with them to not watch news and not watch the stories and limit their intake of that. And it was because you had nothing. What else did you have? You weren't going to work, you were working from home. So what did you have? You had the television as an entertainment, but which, depression and anxiety weaponized for some. So the substance abuse and alcohol abuse disorder did uptick, mostly because of the stressors and ill coping mechanisms, and also the ability for young folks to access. Because when I work a lot with the Native American community, and I noticed that, because I'd ask, well, how did you afford a gallon a day? And then they would tell me, oh, I got unemployment money, and not that unemployment money was bad at any case, because we needed it to live. But then you had the mix of people just not coping well. And I can understand that, because if you don't seek professional help, if you're only looking to do things yourself and keep in that secret bubble, these kind of things uptick. And unfortunately, it was just an unfortunate thing. And now we're seeing it again with the uptick in violence, the gun violence has started back up. So unfortunately, we just don't have the right coping mechanisms that are rampant. Definitely coming back to the house of worship is going to make a big difference. And I think people need that to be able to be grounded. And luckily, I love that the church was able to pivot and get these forums out on YouTube and, the different content, because that's where I guided most people to go back to. Go back to where these recordings are. Go back to your roots, so you can not sway off into.
Absolutely. I like that. So, and basically, when you were talking about having some type of substance abuse, it's almost like they were numbing the situation. They weren't addressing the situation. They were just making it numb, making it what they call disappear.
Yes.
And that's the way they do it. Tell us a little bit about some of the myths, some of the things that we talk about, some stigmas as it relates to.
Well, the stigma with definitely depression. People believe, like, if I get diagnosed with it, I'm gonna have it forever. I'm always, and they like to use the word crazy, which, drives me crazy, because it's not fair to someone who's dealing with something. Right. Yes, it is a mindset. Yeah. Yes, you can have negative and positive mindsets, but depression is so much more. Right. And it is, like I always tell my patients, if I was to take a brain scan of your brain and actually have a normal brain and a depressed brain, you could see the difference. Yeah. So there's actual neurochemicals in the brain that are disrupted by the prolonged, prolonged lockdown, the prolonged, I would say kind of the news, that was violence for us. Right, there was a lot of violence. We suffered with definitely violent characterizations on TV that were actually happening. We were able to see things more, and because we didn't have anywhere to go, we watched the news and we've seen all these killings and deaths in our community, and then we've seen the pandemic hit our community. So this became, that's how you could get to the point of mental illness, where depression is clinical, because the chemicals in your brain actually change. Your serotonin and your dopamine levels are not where they need to be because of the constant stress. So it's actually an internal disease thing that takes place, and it's not just fair to say, think yourself better, or you'll feel better if you look better. You know
what, Dr. Norris, you said something, I'm sorry, and I want everyone to hear what was said. Just like if you were to take someone's blood pressure, and their blood pressure is elevated, they take medication for the blood pressure because they can show that there was an elevation in blood pressure. If you take someone's blood sugar, their glucose level, blood sugar, A1C is elevated because you can show that there's something wrong with their blood sugar. So you treat those things, right?
That's correct.
When you look at a brain scan, you can see there's some disturbance. I work in the neurological department, and I get it. I get it. And that's what we want the audience to do, get it.
Exactly.
We can see that there has been some disturbance. That's actually how you determine that's one way you determine where there's some type of mental concern.
That's correct.
Because of the fact there's something that has interrupted that individual's activity of daily living. We elaborated on COVID. We've been talking about that all through the presentation. We've never talked about the social unrest. We never talked about all of the other stigma and things that are perceived as stigma throughout our country, but it is real to many of us. And so that was a disturbance. And it's interesting because you can run tests and actually ask questions from utilizing an instrument. And then you can also look on a scan to determine, yes, there's something wrong with you. And I think the moral of the story, but it's okay. And now let's try to address it. Tell us about stress. You know, want to kind of look a little bit more onto stress.
And so you talked a little bit, the next slide to show us the anxiety disorder versus kind of what is normal anxiety and out of anxiety.
Got it.
We kind of talked a little bit about that, and this is kind of gets us back to, like I said, it's normal to feel stressful in difficult times. And then anxiety disorder, you may just get a disruption, something didn't happen, and you're nervous and you're upset. You didn't understand where that's coming from.
Right.
That's kind of an anxiety disorder where you just can't go out with somewhere, and it's not COVID related. It's not, you know, you don't want to do this, and you don't understand why. So some of that, and like I said, the clinical part is when it's disruptive. So that's where that one is going. And then when we're trying to kind of head off some of these things, the things that we do is stress busters. We want to definitely look at taking out stress to kind of hit that depression reset and that anxiety reset button, because those can do it more often.
So these are some of the tips you're referring to?
Yeah. So under those, when we go to that, whether it's hitting me and you know there's a problem, do some of these things to kind of offset, so that when you come, like if you come to see a medical professional, so that you can say, hey, I'm doing these things to help me, and I still need a little bit more help. So some of the things that we like to do is make sure that you're getting sleep. So if you're having difficulty getting to sleep, talk to someone, because that's going to be your major stress reliever. Focus on what you do well. Sometimes when we're depressed and we're anxious or we're sad about something, we look at the negative or what's all going wrong. The thing I like to tell people is don't catastrophize things. Don't think of all the 6 things that's going wrong. Take it one step at a time. Look at one problem at a time. So look at your strengths. Have you been through things before that you came over? Did you lose jobs before? Did you have a problem before? And the one good thing is that the job market is really hot right now. So the thing is, if we can get to a point where we're healthy enough, we can go out and get those things and feel good about them. Do things that normally make you happy. If you like comedy, turn on comedy. If you love your prayer groups, call your prayer groups, have more of them. You know, and then physical activity, definitely trying to get out. Here for us is a little harder in Arizona because it's 115 out there. But what we would like to do is definitely, you know, look at your malls, because we can go to the malls in the morning and walk. Their stores open up early where you'll just be able to walk around. Look for activities that you can do. If you can't do nothing but laps in your house, make it a point to get up and get moving, because when you move, your body and your brain is saying, I'm okay. Right. And then we are meant to, by designed to be hunters and gatherers, to go and move and be mobile, not always to be at the clicker. And then always talk to someone, and talk to someone that's healthy for you to talk to. Exactly. You know, the negative people who are going to bring you down, steer over to those people who have a good conversation for you, who have something positive to say. Try to look at your circle. Make sure you're engaging with those people that are positive. And when you have people that are in need of help, I like to tell people, don't feel like you have to save everyone. Your mission may be just to point them to a person that can actually help them. I like that. So that you don't put on baggage of other folks, because I have a lot of people that don't have good boundaries, and that happens to them also.
Okay.
Because then that's easy to do in COVID, because everybody's stressed out about something. So if you're finding, you know, don't isolate, because
you want to save everybody.
Yeah, you can't do it. We can't do it. So I have to tell myself boundaries and make sure you point them in the right direction so that you can be healthy and they can be healthy.
I like that slide. Let's go to the next one and talk about stress. How do we fight stress?
Stress is knowing how much is on your plate. Knowing what you can handle, kind of looking at what you can do. I think a lot of us might have learned that during COVID, when we had to sit here with everybody in the house and we had to, you know, figure out whether we're going to go to jail today or we're going to make it through the day. So we just sat there and made sure that you edged out things for yourself. So one of the big things is slow down. Just everything doesn't have to be right now. And if it does, you know, look at it as, if this ball drops, is that going to be the end? If it's not one of those ending balls, then maybe you set it aside. And, you know, like they said, hitting snooze on the alarm clock. But snooze also in your life. Maybe you can't do 5 things this week. Maybe you need to take a few of them off. And then always, like I said, laughter is the key. You know, getting good laughs, being around funny things and happy things, and knowing a lot of times what we do, I always tell people, is try to, you know, even in the morning, get out, get some sun, just let it hit you so your body knows and you get on that rhythm. You know, I tell people to go out early in the day, kind of to set your circadian clock.
Right.
So you go out in the middle, you go out in the afternoon, you go out at night, so you can tell your body when to slow down, how to get sleep. And then the other thing is get organized. Put things where they go. You know, have a plan. Having a planner, journaling, writing things down. You know, we got these phones are our brains now. We can just put it on our calendar what we need to do. So if we know we're not missing things and we know that something's going to remind us, we don't have to have stress about that. And like I said, get up, move, have some type of routine. If you're, you know, a lot of jobs are work from home now. So now you have to look for, there's excellent YouTube videos on physical activities that you can do just on your chair exercises, little things that can help us. And then focus on things that you can change.
Okay.
So if something's bothering you, I would always say, look, tell me what you can do. You told me everything that's wrong, but tell me what you can do. And if you tackle those, celebrate them.
Right.
So that you have something to have joy for and happiness in that day.
I like that. Thank you. That's good. I was just thinking of a scripture, God will not give you no more than you can bear.
That's right.
We give ourselves those things.
And
it's not something that we should try to take on if he's not giving us those things. Let's talk about the 7 steps or tips, if you will, to stress, as it relates to stress.
Okay, so definitely with they're similar, just going back over the thing. I can't stress it enough, getting enough sleep. You know, I find my graveyard shift people have a harder time with this, you know, because they're trying to do too much and also balance family life and stuff. So really trying to set aside and organize yourself to where you're planning your sleep and you're planning your day so that you get enough sleep. I don't really go into hours because everyone knows how much is good for them. Some people are good with 5, some people are good with 8. But your body rebuilds itself when it's sleep. Your mind repairs itself when it's sleep. So in your cells, we all need that to rejuvenate ourselves. So those are just, again, the same thing, having the connections with others, making sure that, you know, if you're doing a lot of webinars and a lot of things, turn on the camera. Be camera ready so you can see. It's something when we connect with another human and we smile at them. If you ever notice infants and babies, if you smile at them, they smile back because that makes you feel good. We are designed by God to be able to connect with one another. He made us to be loving beings and kind beings. Then that's what we need. We need to see everybody's face. We don't need to just interact with a computer screen. We need to be able to connect with others. So those are stress. In the stressful situations, you know, try not to run from them, plan them out, and plan a strategy. If something's really bothering you, if something's really heavy, try to write it down and look at all angles and not just the bad, but what can you do about the certain situation.
You know, you talked a lot about non-pharmacological approaches when it comes to depression and anxiety. Are there any pharmacological medications that one should take? And if that's so, would they be on them for the rest of their life?
Absolutely, and that's one thing that slide alluded to earlier, that it's not a life sentence. It doesn't mean that if you have a depressive episode where you've had a break and you've needed to not work or not be able to be functional for a while until you're able to be rebuilt. There are different pharmacological agents that we use, and most of the times it's just for a short period, usually 6 months to a year. I like to look at how I personalize it to the person. How did it affect them? How long was the mental breakdown? How long, and then how long have you not said nothing and you've been suffering with it? Because believe it or not, depression is curable. It's not where you have to just be like that forever. Like you kind of mentioned, you can go through rhythms, and if you get those, most of the thing is a pill is not going to cure it. So it's going to have to be lifestyle changes. It's going to have to be that talk therapy, maybe not every day, all day, but definitely learning the tools, because the medication is only going to take you so far. I can correct the chemicals that the brain scans show, the serotonin and dopamine levels that are not hitting where they need to. But the biggest thing is, are you changing the lifestyle? Are you changing your stressors? Are you changing the way you look at things and the way things hit you? Not because something wrong with you, but we need to manage how much that brain gets impacted by stress, if that makes sense.
No, that makes a lot of sense. And I was just thinking of looking at all of these things here. And my audience know, our audience here at Antioch know, I'm very personable. I talk a lot about what I do because I know it's important as a healthcare professional. As part of the health ministry here, people not only listen to you, but they look to what are you doing? Because oftentimes, when you say something, you obviously have to show it as well. And yeah, getting enough sleep is important. And I think what you shared with getting enough sleep, your sleep hygiene. So identify what ways you need to rest. Removing the television from the bedroom is one that I've often shared with people. If there's a medication you have to take it. I think, relaxing more. And there are people, even though they're in their home, they don't know how to relax. And they have that anxiety issue, so they have to find ways to suppress that. Looking at social networks. I love the fact, turning on the camera. Some days I'm not camera ready. But you know what? By this time, most of the people that I meet with, especially my regular meetings, they know how I look. So I'm like, look, I'm not camera ready, but I'm going to turn it on because I need you to see me and I need to see you, right? So I think that's important. And if it's not the Zoom, FaceTime your family. They know how you look, so you can at least see them. My family's in Michigan as well, and I'm often, when I'm on the phone with my mom, I'm like, Mom, FaceTime. We got to see each other at least, at some point. Managing your time. I write. I still have a calendar. Even though we use the phone, I still kind of jot down things like, what am I going to do today? I call it my things to do day, because you know me. So I said, you know what? Check, check, check. I still have to grade papers today, so that's still that check at the bottom. So we have to make sure that we're writing things down. Resolve stressful situations. Obviously, if it's with a relationship with someone, make sure that they know that you're okay, they're okay, and making sure everything's good. Nurture yourself and also ask for help. And I think that's one of the key areas, is asking for help. But I have to laugh because as you were talking, that wind down period, the audience would know now, at the end of the day, what I do to wind down is I sit in my favorite chair or seat, I turn on the television, and I find one episode of whatever program that is going to be funny or I'm going to enjoy, and I look at 30 minutes. I might sneak in a second 30 minutes, and then I'll just say, okay, that's it. And I would like to go to bed with a smile. And if it's looking at something that's going to make me laugh, I'd rather, lay down with that smile on my face on the last thing that I've heard, as opposed to being upset or stressful or having some anxiety periods when I go to sleep. So I think that's extremely important, because I always felt like that my behavior and the way I feel is going to go with me when I go to sleep. So I think that's important.
And I love that, because that's one of the things that I help people when they present to me with anxiety, is how to calm down. And we have several techniques, such as deep breathing exercises. I teach people how to do that, and I utilize them myself. When I've had a very stressful day, I'll take we didn't have that on our stress reduce, but it definitely helps with the anxiety reduction. I didn't speak a lot on medications, is because that's kind of, especially for our community, that's like our taboo button. You say medications, everybody runs. So we, on the other hand, culturally, we're not ones to be very trusting of medications. So I think that if people talk to someone and get that understanding of what's going on with them, because it's personal for everyone. But there are medications that are very much tried, trusted, and true, that's been around for years, that really, really do work. So, but when we get to that point, I give options. I always try to make sure that I'm communicating with my patients, and I think that's what you need to look for in a clinician, someone that's listening to you. Do they hear you, or do they already have a recipe? So if they have a recipe, can they tell you why that recipe is going to work in your life?
Yeah.
So that's my tidbit on medications, to make sure that you're with a clinician that's listening to you, that's telling you why they're giving you something, and discussing what diagnosis they think may be appropriate. And ourselves being open to being diagnosed, being open to mental health, that if you get it soon enough and catch it faster, the faster you get away from it, the faster you reset these chemicals that are off. So those are my tidbit about that. And then the other things that I do at night, kind of like yourself, if it's a stressful night, I'd love, I'm not good at one episode, so Netflix has me binge watching things, so I have to have a Netflix night. But definitely taking away the phones. Like, I make it a point that I'm not texting, I'm not looking at stuff, at least an hour before bed.
Good. Because
you need to let the brain reset. These computers, these different lights and different things, they affect us. They affect our brain, they affect our function. So a lot of times these stressors are environmental. It's not really our fault. So if you fall into this anxiety, you fall into this depression, it can come from foods, it can come from environment. So that's kind of what I wanted to make sure I got across tonight, that is one of the biggest myths out there, that depression, anxiety is somehow that person's fault. That may not be the case. It may be genetic. It may be a genetic disposition. You see a lot of people, bipolar gets a lot of bad publicity because of what you see on TV is, if it was a mass shooter, they had a mental disorder and they did this. And I hate that. I cringe, because that is so not the message we want to put out there, that mental disorder somehow means something's wrong with that person or that person's a wreck. That's not always the case. There are people who are mentally disturbed that have not been treated, and that's the key, have not been treated. So if someone wants to help themselves, the best thing to do is seek that help, and to know yourself, know your body, and connect with a provider that's going to listen to you about your body. Because I can tell you about the book all day long, but the book is not going to tell who Dr. Angela is. Dr. Angela is going to tell me who she is. And that's what you want to look for. And then again, de-stressing at night, definitely phones, TV, electronics. Even though people think, this helps me, I play this game, but guess what? Your brain's not going to sleep. Your brain's still in that game. So if you don't take that time to reset yourself, you're setting yourself up to be at this high level of stress that you don't even know about. It's going to take you that much longer to get into that healthy level of sleep.
So it's like, basically, be receptive to the diagnosis. Do not delay your detection. It's just like cancer and anything else. And then also just be able to know how to de-escalate yourselves throughout that day. And I think when you pointed out technology, what are some of the resources? Because I'm hearing so much, and I know there's so many of our listeners and viewers are going to say, well, where do we get this information? How can we actually get support?
Well, there's very good support out there. There's definitely, what we have is the list of numbers, which we'll be able to provide at the end on our slides so that you can write them down. But there's the National Suicide Hotline, which is 24 hours, 7 days a week, if you are to the point where you're feeling unsafe, unsure. That doesn't mean that you definitely have something up to your head and you're about to go. When you feel like you're getting to the unsafe, where you feel like, well, I don't care if I don't wake up tomorrow. Those are the times to reach out to these individuals, because they're trained professionals on the other end. And they're going to get you to the local resources in your neighborhood, or bring someone out to you right away so that you don't delay. The early detection is the best detection, speaking to someone. And also, you know, the crisis line, our crisis line here in Arizona is open. They have several of them. We have the crisis line, we have the national line, we have different ones for military people that may need help. We have family advocacy of victims. That's more of a 9 to 5, or assault line, you know, for people that are experiencing an emergency, and there's always 911. However, 911 is not always equipped for mental emergency, so I increasingly ask people to call the crisis line. And we also have where they'll be able to, they have apps now that will help you with resources. So on our second slide, we also have apps that have different things that you can go to. And here is a different resources for work, education, if you're having trouble with resources. So these ones here are for medical resources. A lot of people don't know that, you know, this administration made the Affordable Health Care Act more available and kept the application times on longer. So making sure that if your problem from getting mental help is because you don't have access to insurance, call these numbers. They have places that have sliding scales and or free help, or have grants that have been given to them so that they can provide affordable mental health care.
And there's another, I think there's additional information on resources on our next slide.
I think
so.
Yep. So these right here is going to be places and how you can access mental health. So people that are employed, most employers have EAP line, which is free to you. You can call that and they'll get you in touch with mental health workers, law places that they provide. They will send you to low cost places where they can help you with legal issues. Call your insurance company. On the back of your card, there's a 1-800 number that can always tell you who the providers are in your area and who your insurance carrier is contracted with to provide those services to you. And also your family doctor, your primary care, open up to them, let them know. Usually that's our first line of defense. I have a lot of family practice and a lot of internal medicine doctors who refer their patients over and come talk to me. Just because you come talk to a mental health care worker doesn't mean you're off the charts. It just means we're trying to prevent something to becoming off the charts. And if you're off the charts, we want to help you right away.
I like the fact you talked about your primary care provider. Your primary care provider has the baseline. They know you.
That's
Even
right.
your spiritual leader knows you, right?
Yeah, absolutely.
So they have that baseline, and they know that if there's something different that's going on with you, they'll be able to address it. So that's the key right there. That's very important. What about you? I think you're phenomenal. I love working with you with the Black nurses. I love working with you in the community. But let's talk about you. I think that was a question that someone asked. You know, how do we learn more about not only just our resources, but also contacting you? And I think I have your information with all of your alphabet letters behind your name.
Right. That might be a problem in itself. But yeah, my basically, the name of my practice is Generational Wellness. And the thought, how that was birthed is I wanted to definitely attack the stigma of mental health care. I wanted to attack the stigma of chronic illness. We don't have to live that lifestyle. Even I talk to my husband sometimes and we joke because maybe diabetes runs heavy in his family, and heart disease, strokes. So what I say is, yes, you may have that gene or that factor, but we can change that with, you know, positive, healthy outcomes. We can break that generational curse. We can come after that. And that's where generational wellness came. I wanted to break these generational curses. I wanted to take the auntie or uncle that's in the back room with the door closed out of that back room. Because it doesn't have to be that way. Just because someone's suffering from serious mental illness don't mean they need to be locked away. There's so many treatments out here that let people live a healthy and robust life. Some of the people that I have in my practice have schizophrenia, but they go to college. They're sitting in college classes, taking college courses. It doesn't have to be this bad if we can just open up and be, like you said, go to your spiritual leaders. And now I love this time that we're in, because spiritual leaders have opened the doors to it. It's no longer something's wrong with you or you're just cursed. It's no longer that anymore. It's now that we realize that it's a medical disease, we're actually bringing people into the fold and getting them help. So for myself is even having close family members that have had this disease and wasn't treated right was my driving factor to always learn more and learn more and get more. I had family members that succumbed to different chronic illnesses, so that fueled me as a young adult to start in the nursing field, you know, way young out there, trying to learn and trying to bring health and happiness to our community.
Well, you know, Dr. Norris, you pretty much closed my, gave a wonderful presentation in closing this, this evening's presentation. So I thank you. I thank you for all of the information, dispelling the myths, the stigma, removing that, allowing anybody and everybody, Black and brown people, to know that we matter. Yes, we matter. We matter. I think that's so important. And if we voice the fact that we matter, we have to show that we matter. We have to be able to care for ourselves. Yes. So I want to again thank you for this wonderful evening. I want to also let our viewers know that we do have some additional presentations that are going. I hope you're able to join us online. Absolutely. And those presentations, we're going to be talking next week, minding your business. So looking at the holistic individual. We've talked about physical, mental, and of course we're in the house of worship, so we've always talked about spiritual. We'll also be looking at financial peace, so we'll be talking about that. And then because we talked about social unrest, we're going to have our law enforcement person talk to us towards the end of this month. So again, thank you. And again, thank you for our listeners. And I thank you again for tuning in. I do believe we will have our very own Dr. Jonathan E. Logan, who will be closing us out this evening. So thank you.
Thank you.
Praise the Lord, saints. I am so glad that you were able to tune in tonight to hear this wonderful presentation. I definitely want to thank Dr. Norris for sharing some practical things about mental health so that we can be open and honest about what we're going through in our lives. I love the saying that she said about secrets. I always say, never suffer in silence. Let people know what you're going through so that you can get the help that you need. One thing I would ask you to do tonight, many of us know people that could benefit from the many things that we've shown in our health series. I need you to share those things, talk it up, ensure that this information gets into the hands of people that need it and can benefit from it. We have sent our videos to the city of Peoria so that they can put it on their website. Because some of the top medical professionals are sharing, and we want to make sure that this is disseminated in our community as broadly as possible. So hope you had a wonderful time tonight, and make sure that you tune in this coming Wednesday so that you can hear the conclusion of the matter. We'll be doing this all the way through the month of July, and so we want you to tune in so that you can benefit. Again, I want to thank Dr. Norris. I want to thank Dr. Allen for sharing, and of course, I want to thank Dr. Christopher Pullins for all that he has done to help us doing our summer health series as well. With that, let us bow our heads in prayer. Lord Jesus, we are just so grateful for all the wonderful things that we are able to hear. We are much better prepared to deal with the ups and downs of life because of the things that we are learning. We realize that life, especially in a pandemic, is very, very stressful and very difficult. But by getting strategies that can help us to cope with the challenges better, will enhance our lives and enable us to serve Christ on a much higher level. We pray, oh God, that you would just help the people to realize that they don't have to fight the battles by themselves. But there are others who can help them and cause their journey to be much more successful by being armed with tools that can help them to recognize and get help early. We also pray for Dr. Norris and her practice, that you would allow it to prosper, allow it to continue to reach out deep into our community and continue to make a difference in the lives of suffering humanity. We pray for all of the medical professionals. We thank you, first of all, for the service that they have provided to our community. And we also pray that you would continue to give them strength as they minister to others and as they minister to their own families. We say thank you, Lord, for blessing us with such a large group and such a well qualified group of professionals. We are the better for it, and we give you praise and we give you the honor and glory for all that has been done. We ask this now in the precious name of Jesus, and all of the people of God said, amen. God bless you. Have a wonderful week, and we look forward to seeing you this Sunday morning as we again come to share the word of the Lord with you. God bless you.